Dr. Rhonda Randall is on the phone. She's the Executive Vice President and Chief Medical Officer at United Healthcare National. And she's, I'm sorry? Oh, National Markets. Okay, Thank you. She's talking to us about the United Health Foundation America's Health Ranking Senior Report. So tell us about the senior report. Does that mean us? Because we're old.
Well, this is the 7th year that the United Health Foundation has published an America's Health Rankings report focused on the health of seniors. And for the most part, that means people over the age of 65 in this report. We look at 34 different measures of health, from our behaviors as individuals to the community and environment where we live, to the medical care we get when we go to the doctor or the hospital, and ultimately our health outcomes.
Oh, okay. And is it Florida specific, or is it pretty much across the country?
It's a national ranking. So for the last 7 years, we have ranked all 50 states in relativity to one another and how they're doing on senior health. And then we have the ability to drill down on a specific state like Florida.
And your senior health report is all encompassing because you not only have results about the physical, but also of the monetary.
Yes, we look very comprehensively at how we define health. Not only our medical health and the absence of disease, but you're correct, our financial health, our emotional health and well-being, and many more.
Oh, really? See, as I get older, I feel happier. I see a lot of people feeling sadder, but I'm one of those guys that everything's working out for me. I'm just a lucky one, right?
Well, I'm happy to hear that. One of the trends that we saw this year, we took a specific look at young seniors today versus their young senior counterparts 15 years ago to see if there were significant differences in their health. And we do see that younger seniors today are reporting more frequent mental distress than those 15 years ago. That means 14 or more days out of the last 30 days, they feel mental distress.
Okay, so they say that when you get older, people who are old, as you would have thought old when you were 30, they start looking younger. But the other day, I'm telling you, we were with a lady. This is no joke. She had grandchildren, and her children were 34, 35 years old. Mm-hmm. And I swear she looked like she was 25. Yeah. I am not making that up. She really did. So we're doing something right with our bodies, right? Or at least some of us are.
Well, this report has some really nice bright spots in it. It gives us some encouraging news, and then there's also some things that we're concerned about. As far as longevity is concerned, one of the things that we see in this report, particularly with younger seniors, they're less likely to die prematurely. They're less likely to die young. So that's good news, but they're also more likely to live with a chronic disease like obesity, often caused by our lifestyle choices.
Yeah.
So living longer, but living sicker.
You also touched on volunteerism. You say that Florida ranks number 47 in the nation, that the seniors aren't volunteering as much as they used to.
Yeah, we use this measure as a proxy for maintaining purpose as you age, and certainly volunteering is not the only way to do that, but it's one of the measures that we can get data on for all 50 states in the same way. And Florida is ranked 47th in the nation. About 20% of people over the age of 65 self-report that they volunteered in their community at some point in the prior measurement period. So there's an opportunity for more seniors to get involved and active in something that they care about.
So how do doctors use this report, and do we, the consumer, how do we use it?
We really hope that this report is used to identify those health and wellness successes and challenges that we're seeing in a particular state and across the nation. So it is a call to action, not only for individuals, because there's our behaviors in this report. And when you look at the behaviors for seniors in Florida, the one that we have ranked the lowest and that have the greatest challenge at is excessive drinking. Ranked 45th in the nation for the amount of seniors who are drinking excessively. And then there's another measure, we're ranked number 7 in the nation, so this is a good thing, the percentage of seniors who self-report that they are obese. So continue to do those things that are causing healthy lifestyle choices in Florida. And then from a public policy standpoint, we also look at what can state leaders take a look at to do. One of the things that we see there as an opportunity is there is a high rate of healthcare associated infection, and sometimes policies around health infection control in healthcare facilities can help bring that number down. Florida's ranked 48th there. And at the same time, in the top 10 for prescription drug coverage. So Florida is ranked number 8 in the nation for seniors who have prescription drug coverage, and that's a good thing.
You also take a look at 4- and 5-star nursing homes and pay attention to the number of beds there for around-the-clock care.
That's correct. And Florida has a high rate of 4- and 5-star nursing home beds. They're ranked 4th in the nation. So we know from other survey data not contained in this report that seniors prefer to get their care in a less restrictive setting in their home if it's safely possible. But we know sometimes seniors need to be in a long-term care facility to get that care when they need more assistance with their activities of daily living. And when that occurs, you want to make sure they have access to really high-quality nursing home care. And they do in Florida.
Living in Orlando, you probably have the same thing we have here in Ocala, where there's quite a number of assisted living facilities and nursing homes. And so you would automatically think, well, the population must be mostly older people. But the thing is that those nursing homes attract nurses who are usually younger. And other people in the health professions who are usually younger. So our town is starting to have a whole renaissance in a way of just youth, and we just have some vibrancy going on here that we haven't had for a long time. And I think it's because of that. I think we're seeing a lot of nursing homes going up, but we're also seeing a lot of young people moving in to take those jobs.
Well, one of the other things that we look for in this report that you mentioned is the healthcare workforce. We know that there has been a shortage of people who are trained specifically to take care of an aging population. So 2 of them that we look at are geriatricians, the number of geriatricians, and Florida needs more of them. Florida is ranked 37th in the nation for the availability of geriatricians. And the other thing that we see is home health aides. So we know that the access to home health aides can help us live in our homes longer. That number is up nationally. 550,000 more people are licensed home health aides in 2019 versus 2018. And that number is up in Florida as well, although Florida still lags behind most of the rest of the nation in that measure.
Oh, really? So before we say goodbye, is there a website that our listeners can go to read the report for themselves?
Please go to americashealthranking.org.
That's easy enough. americashealthranking.org. Dr. Rhonda Randall, thank you so much for being on the show with us today.
Thank you. Be well.
You are welcome. We'll be right back.